Did you know that people with gum disease are more likely to develop high blood pressure? In fact, recent studies show a 20% higher risk of hypertension for those with poor oral health. Surprising, right? Today, we're going to explore the shocking link between your dental health and your blood pressure. Welcome back to the channel. Today, we're diving into a topic that connects two areas of health you might not immediately associate with each other: oral health and hypertension. Most people know that taking care of their teeth is important for preventing cavities and gum disease, but did you realize that the condition of your mouth could actually impact your heart and blood pressure? The link between bad teeth and high blood pressure is stronger than you might think. In this video, we'll explore why this connection exists and why you should care about it. Let's talk about the problem. Poor dental health can lead to far more serious issues than just a toothache or a trip to the dentist. Gum disease, also known as periodontitis, isn't just a problem for your mouth, it can lead to systemic health issues. When bacteria from your mouth enter your bloodstream, it can cause inflammation throughout your body, including your arteries. This inflammation can make it harder for your heart to pump blood and, over time, raise your blood pressure, potentially leading to hypertension. Many people don't realize the importance of maintaining good dental hygiene beyond just brushing to prevent cavities. The health of your gums is equally important, and neglecting it can set off a chain reaction that affects your heart, your brain, and other critical parts of your body. For those already struggling with high blood pressure, not taking care of their oral health could make it worse. Let's dive deeper into how poor oral health can directly contribute to hypertension. One of the most significant links between oral health and hypertension involves bacteria. When you have gum disease, the gums are inflamed, and bacteria can travel from your mouth into your bloodstream. Once there, these bacteria can cause inflammation in the blood vessels, which makes it harder for your arteries to expand and contract properly. This, in turn, increases blood pressure because your heart has to work harder to pump blood through these narrowed, inflamed vessels. A study published in the Journal of Hypertension found that people with periodontitis are far more likely to suffer from elevated blood pressure. In fact, participants with severe gum disease were more likely to have uncontrolled hypertension, even when they were on medication for their blood pressure. This suggests that even if you're treating your high blood pressure with medications, poor oral health could be working against you. Inflammation is a key factor in the link between oral health and hypertension. When your gums are infected, your body responds by producing inflammatory markers, such as C-reactive protein, CRP. These markers don't just stay in your mouth, they circulate throughout your bloodstream and can contribute to chronic inflammation elsewhere in your body. This inflammation affects the endothelium, which is the lining of your blood vessels, leading to endothelial dysfunction. This dysfunction reduces the elasticity of the arteries, increasing vascular resistance, and as a result, raising blood pressure. Chronic inflammation, especially when combined with other risk factors like poor diet or smoking, significantly increases your risk of developing hypertension and other cardiovascular diseases. There's a saying that the mouth is the gateway to the body, and this couldn't be more true when it comes to heart health. Gum disease has been linked to several cardiovascular issues, including heart disease, heart attacks, and strokes. The bacteria responsible for gum disease can cause plaque buildup in the arteries, leading to atherosclerosis, a condition where the arteries harden and narrow. This makes it more difficult for blood to flow freely and can trigger high blood pressure. What's more, studies show that people with periodontitis are at a significantly higher risk of heart disease and may experience worse outcomes after a heart attack. This is because the infection and inflammation in the mouth don't stay localized, they travel throughout your body, affecting your arterial health and, ultimately, your heart. It's also worth mentioning that lifestyle factors can exacerbate the connection between oral health and hypertension. Stress, for example, can lead to teeth grinding or jaw clenching, which causes damage to your teeth and gums. Stress is also a well-known contributor to high blood pressure, making the combination of stress-related dental issues and hypertension a dangerous mix. Similarly, poor diet and smoking are linked to both poor dental health and hypertension. A diet high in sugar and processed foods can contribute to tooth decay and gum disease, while also raising your risk of high blood pressure. Smoking, on the other hand, not only causes gum disease but also narrows the arteries, leading to higher blood pressure and an increased risk of heart disease. Here's the most shocking insight from the research. Studies show that treating gum disease can actually help lower blood pressure. One trial found that people who received intensive treatment for periodontitis saw a drop in their systolic blood pressure by as much as 12 points compared to those who didn't receive treatment. This effect was so pronounced that researchers suggested dentists could play a critical role in helping to manage hypertension through regular oral care. This finding highlights the urgency of addressing dental health, not just for your teeth, but for your overall well-being. Imagine going to the dentist not only to prevent cavities but to lower your blood pressure and reduce your risk of serious cardiovascular issues. To sum it up, there's a clear and important connection between your oral health and your blood pressure. Poor dental hygiene can lead to gum disease, which allows bacteria to enter your bloodstream, causing inflammation and potentially leading to hypertension. This inflammation can affect your arteries, making it harder for your heart to pump blood and increasing your risk of heart disease, strokes, and other health problems. The good news: taking care of your oral health can go a long way in supporting your overall health, including your heart and blood pressure. Regular brushing, flossing, and dental checkups are essential, not just for keeping your teeth in good shape, but for maintaining your blood pressure and preventing serious health conditions. Now it's your turn. Have you noticed how oral health affects your overall well-being? Share your thoughts or experiences in the comments below. And if you want to learn more about how different areas of health are connected, be sure to like, subscribe, and check out my other videos on health and wellness. Thanks for watching, and I'll see you next time.